This is my weekly recording for my primary survey and rapid trauma survey. First thing I'll be doing is checking and asking for if there's any hazards. There isn't any. Asking and checking how many patients I have. There is one. My ethane report would be the exact location would be 32 Wallaby Way, Newcastle. Type of incident is a fall from a flight of stairs. Hazards, there isn't any. I have access to my patient, nothing blocking my way. Number of patients is 1, and I'll be calling for the highest emergency clinical level. The general impressions of my patient that I have is that she's quite pale and clammy. However, her temperature of her skin is normal, her breathing is normal, and my mechanism of injury is the right leg is severely broken. There is no catastrophic hemorrhage. However, I'll be putting my patient in a C-supine position because I'm suspecting that there is a spinal injury, checking the airways to make sure that they're clear, and they are. Now I'm going to be examining the head to make sure that there's no liquid coming out of the ears or the nose, checking for DCAP BLS tick, which is deformities, contusions, abrasions, penetrations, burns, lacerations, swelling, tenderness, instability, and crepitus. There isn't any. Checking pupils for battle signs of raccoon eyes. There isn't any. Moving down to the neck, checking for DCAP BLS tick. There is no vein distension or tracheal deviation. It is normal. Next thing that I'll be doing is checking the chest, DCAP BLS tick, auscultating in 6 places, listening to the heart sounds. The heart sounds normal, the breathing is normal. However, if it was abnormal, I would percuss the chestal area. Now I'm going to examine my abdominal area for DCAP BLS tick. There isn't any. Checking for any tenderness, rigidity, distension, or contusions or penetrations. There isn't any. Listening to bowel sounds in 4 places. Yep, so once I auscultated there, it's normal. Now I'm checking the pelvis for DCAP BLS tick. There isn't any, it is normal. Now I'm going to be checking for the lower and upper extremities to make sure that there's no DCAP BLS tick. There isn't any, except for the right leg. It is severely broken. Checking the grip strength on both. Right leg is obviously abnormal. Checking for a distal pulse, there is one. If I could access it, I would check the posterior DCAP BLS tick. However, I'm not going to move my patient because of a suspected spinal injury. My observations would include my respiratory rate, SpO2, heart rate, heart rhythm, blood pressure, GCSs, BGL, temperature, chest sounds, heart sounds, abdominal sounds. Thank you.